Welcome, welcome to the For Your Best Self podcast. I'm Dr. Rebecca Novo, and joining me is the extremely synergistic Maxwell. We call him Max, Pulling, PA. If you have not checked out Max's previous podcast with Dr. Saluja, introducing him, please take a listen. That was dropped July 3rd. So welcome, Max.
Thank you so much. Thanks for having me.
Good to be back in the studio.
Yeah.
We both finished up busy days, busy weeks in the clinic, seeing patients, and we're here to talk about a favorite topic.
Yeah. So
the butt. Well, we're going to call it gluteal shaping. Synergistic and safe solutions for gluteal shaping.
Yeah.
One of our foundational values is safety.
Mm-hmm.
As well as synergy. So we're here
Nice.
to really talk about that in the context of gluteal shaping.
Yeah.
And Max has a lot of experience with this, using different products to layer safely with really great results.
Yeah. It's a topic that's kind of been a little bit more talked about of recent, and I think the past couple of years, I think social media has played a big role in that, and being aware of what options are, and I think that people want to see what they can do, and ultimately,
Absolutely.
surgery that was the BBL is always the big topic, not just
Literally.
the BBL.
So BBL, Brazilian butt lift. If you're in Florida, you've seen this all over the news. When I finished training in plastic and reconstructive surgery in Miami, it was one procedure I knew that I would not offer. It is the highest rate of death for elective surgery. So I think even with the new laws, in Florida alone in the past few years, there's been dozens of deaths. And you're talking moms, young women, really looking to enhance their figure, not knowing that there's other safe options.
Yep.
And I also always talk about don't pursue plastic surgery for fads or something. I mean, gluteal aesthetic, let's face it, it's very personal, it's regional, it's geographical. So it is just nice to know that there are other options.
Without a doubt.
So that is our why we do not offer the Brazilian butt lift, which is large volume fat grafting, meaning a surgeon will take 4 to 6 liters of fat liposuction removed from the tummy or legs and then inject that into the gluteal area for enhancement. Even if you're following the news, it's been so dangerous that Florida's passed into law to protect patients that now the surgeons are limited to how many of these procedures they can perform in a day, and all procedures must be performed under ultrasound to avoid the risk of fat embolization into the venous structures, which is really why we're having so many complications. So that's our why. We don't offer it, but we never say no without having a phenomenal solution.
Yeah.
So that's what we're going to talk about today. So how do we think about the gluteal shaping? Let's talk about from a 3D perspective.
Yeah. And I think that's a good point, because a lot of times, even when people come in I've seen a lot of patients even post BBLs, and sometimes there's always left to be desired, because ultimately you can only take so much fat. Like you said, you're looking 4 to 6 liters, and then you're centrifuging, and then you're re-injecting.
Right.
And there's a little bit of fat die-off in that too.
Right.
So you're not getting that full volume. And oftentimes people, usually what I've ended up finding in practice, where people end up saying, well, I either get the projection I want or I get the correction of my hip dip. Oftentimes I don't really get both. And when you look at the glutes as a whole, a lot of times we're really trying to defy gravity.
Absolutely.
When you think of that perfect pair of jeans, that you would spend any amount of money on, because you look at yourself in your mirror and you're like, everything just lifts.
Yes.
And it's perfect, and it's high, and it's in place. And then we take those jeans, and then everything starts to fall. And gravity does not play in our favor in this. And that's one of the hardest parts in dealing with the glutes, is we're really taking a larger volume and we're trying to lift. And that can be a difficult thing to do. And there's a lot of different means to do that. But ultimately, there's a lot of different structures and components of that. And it just depends on which area we're focusing on. There's the skin, there's muscle, There's the fat. There is bone, which we're not really touching.
Right.
But,
genetics.
But ultimately, there are core things that we can. I mean, one of the best things to do. That's why we go to the gym.
Absolutely.
If we walk around squatting all day or doing lunges 24/7, you'll get that what you want.
Yeah, I think that is the most cost-effective way to
It is.
build a butt.
Yeah.
Just do those squats, get a personal trainer. I'm spoiled. I was an athlete, so I know. But a lot of people don't know what exercises to do.
Yeah.
I'm sure you could YouTube that. But
Mhm.
can you break down projection?
Yeah. So projection, you're really looking at the outer pole projection. Projection, oftentimes, you think in terms of if somebody stands straight. So I think of Eric from That 70s Show. And if you think of Eric from That 70s Show, that has negative projection. When he turns to his side, there is nothing.
Like pancake butt?
It is
Okay.
pancake. Now, as we start projecting,
We're allowed to say butt in this.
We are.
Gluteal. Butt.
Same. When you think about projection, a lot of times people end up have lower pole projection because gravity is
And
falling.
when we say pole, that's kind of the bottom third.
Yeah, that heaviness. So you think of like the upper third, middle third, lower third. And that lower third, unfortunately, as we age, it just starts to kind of drop. Also, genetics do play a role in this too. And some people are genetically gifted and some people are not.
That's such a nice way of saying it. That is one gifted gluteal pole. We're going to nerd out.
Exactly. But that upper pole is the upper, like, you think about the apple bottom. All right, that upper pole where it curls over and it almost has like that drape-like appearance.
Mm-hmm.
That's what you reference to in terms of that upper pole, and we really try to build that
to lift.
Mm-hmm. And one of the most difficult things to do from a non-surgical standpoint is to get that upper pole, because oftentimes the amount that you have to add in order to achieve that little shelf that you get, when it comes from your low back to the glute, that little bit of a shelf, that's really the definition of the upper pole, and to build that with non-surgical means is difficult, and that's why
cost
sometimes
effectively.
Exactly.
Yeah. And I think too, it's a challenge when usually it's the thinner, more fit patients that are looking for more, and you can't borrow fat from their body. A lot of surgeons in Miami would have patients gain weight, like 10 to 15 pounds, so they could suck and borrow that fat to put it. So we're not asking patients to do that. No. But there are limitations given, where you're going to take fat from. Liposuction is really the art of sculpting, it's you're subtracting, and then the grafting is adding to where you want it. So the synergy in this is, if you're a candidate for liposuction, we can do small volume fat grafting safely in the subcutaneous layer. The danger zone is injecting into the muscle. And deeper planes. Yeah. So you defined pole, and then you said hip dip. So can you take a deep dive?
For sure. So hip dips, you're going to look at that little depression when you stand up and you really flex your glutes. You'll notice how it has this initial depression right there, because when your muscles contract, you'll notice more of that depression because you're tightening everything in. Sometimes it's also accentuating with some of the cellulite that we see, but ultimately the hip dip is just that depression on that lateral, the side of your dip, the side of your hip that has that little concavity. That's one of the things that, if you get the projection, and the one thing I said, when I see a lot of patients that already had those BBLs, and they get the projection or they get the correction of the hip dip, a lot of the times it's a balancing effect, and you really need to create the overall, upper pole and gradually taper that over to the side. Right. You really treat it in like a superior lateral position, and you really almost curve it out, because otherwise, if you give someone projection in that three-dimensional out push, but you don't correct the hip dip, you're not. It ends up looking odd, and that's the same thing in reverse. If you give someone a correction of the hip dip, but not the projection, you've just rounded everything out and not really given them, the true correction that they're looking for. And obviously, this is all customizable. If somebody says, "I have this and I want that," there's always a way to to facilitate or have a better understanding of what that is, and furthermore explain like, hey, this is why this is going on. And that's one of the things I think that in our practice we all as providers do a phenomenal job, is not just saying, hey, these are your options. Exactly. Like,
we're going to educate.
Yeah. What, like, what's the diagnosis, and let's work in reverse. You know, how do we get to that, and what are our options? Because ultimately there's a lot of options.
Right. And when you talk about hip dip, it makes me think of that transition to some patients that have the saddlebag, which is right below the hip dip. And that is one area that does respond really favorably to liposuction. And I think that if you can blend or smooth that contour by taking away from the saddlebag below, it can diminish the,
without a doubt,
the contrast.
Yeah. And that's the biggest thing. You know, oftentimes when we talk about non-surgical interventions in terms of like gluteal augmentation, that's not always the best answer, and liposuction works wonders. But to your point, it is a true art. And I think that that's minimized for a lot of people. And I don't think people really know to the extent of, you know, the artistry that goes into this. And I think in aesthetics, it is the most interesting field, because you have a blend of having to know anatomy incredibly well, having to understand medicine, knowing a person, understanding what their wants, and then ultimately addressing that and saying, how can I artistically give you the result you want in a safe and...
Is it possible?
Yeah.
I think that it's in general overused. So I think knowing the limitations and the safe applications is key. So we've talked about a little terminology, projection, hip dip, and then we know 3-dimensionally what goes into creating the gluteal shape or aging, what we can and can't control. We can work on skin. We're going to talk about cellulite, which is really a combination approach, and we're going to talk about fat solutions. As far as fat grafting, we did want to touch on the recovery of surgery. Surgery is not without restrictions and limitations. We typically, 6 weeks is kind of the magic number for most procedures, because we know that we have near full healing integrity and strength of the healing, and it's usually compression garments. Are you using compression garments for gluteal injections?
It depends on the amount of volume. You know, if we're really going, I've had a patient where we had... like
shapers or...
Yeah, we were doing a pretty large amount, and you know, in that regard, yes, we did. But I think for the vast majority of people, this is a very quick and easy process. Again, customizable depending on the amount, and it depends on the product we're using. You know, ultimately, if I'm using Renuva, which is that fat grafting alternative that we'll get to in a little bit, that one, I do sometimes implement that, especially if I'm using larger volumes. And when we say large volumes, it's not large. It's commensurate with what we want to achieve. And a lot of times these treatments we often offer it's not a one-stop shop. It's
stages.
We really want to treat and say, hey, if we don't have to do all of this, we don't want to. You know, ultimately we want to get you the results, but we want to do it in the means of having the, I always say the lowest therapeutic index. What's the lowest therapeutic index that we can utilize in order to achieve the best results that we have?
Absolutely. So just our solutions, bone, we talked about genetics, we're not changing. This is your foundation. Muscle, tone, build. Fat, we're going to talk about shaping and sculpting, adding, subtracting. Our top products to subtract, we touched on liposuction. Kybella has been termed as liposuction in a bottle. I would say it's not truly cost effective for large areas. It's $500 per vial. And a vial's 2 mLs. So it's famous for submental. It really is off-label, the submentum. I use it in bra bulge, but
that little bit.
I think for refining, if you just wanted to, say, post BBL or other small areas, if you just want to refine small areas, it's a great solution.
It's phenomenal.
Kybella is safe. It's deoxycholic acid, which is what our gallbladders make to digest dietary fat. Scientists have synthesized it and put it in a bottle, so it is specifically targeted for fat. It will disrupt the fat cell that gets broken down and cleared out into your metabolism, lymphatics, and such. There's a little bit of swelling, a little bit of stinging, burning, no downtime per se beyond some modest swelling. Kind of correlates with the amount that you're using. And let's talk about one of our mutual favorite products for adding your top 2 are Radiesse and Renuva.
Correct.
So
I'll touch on Radius and then we'll jump into Renuva. Everything starts with an R.
Yes.
So Radius is a calcium-based filler. It's calcium hydroxyapatite. Traditionally, this is a filler that we utilize greatly in the cheeks and the jawline, and really overall in the face. And it's interesting because it's not a standard hyaluronic acid. This is a calcium-based, and what that means is it's actually part filler and part microsphere. And those microspheres are really what cleave off and also stimulate your type 1 collagen. So back in 2017, they did a study over in Brazil. And the study over in Brazil, they were trying to figure out the right dilution in terms of how do we reconstitute this and blend it down in a way to minimize not necessarily the fill, but also maximize collagen. And they played with all different really ratios, if you will. And the cool part about that is you get to learn how do you reconstitute this and how do you modify this product in order to attain a better result. And ultimately what this product can do is it can fill and it can retexture the skin because it helps to stimulate collagen. The products, you're looking at duration, something like that is upwards towards, if even they found in the studies, like 15, 18 months, which is still pretty good, but it's not, forever. And really nothing is forever in this. Well, most of the time. Nothing really is. So Renuva, we can often take that product, which is normally a really high G prime, which means it really lifts as a filler, and we can blend it down and treat broad areas. So if you think about your décolleté, you think about your neck, hands, it actually has an FDA indication for, but you can also use that for the glutes. You can use it for the thighs as well, and it works really well to retexture. Sometimes in the glutes, it might be a combination of products that we end up picking because ultimately it might be different things I'm trying to achieve. So Radius, it does do a pretty good job in terms of retexturing the skin. The lifting component, that's the one thing it doesn't do as good of a job. So I think it can give you a little bit of projection. It can help with that hip dip, but it doesn't give you the lift that you really need. And that's where we kind of stem into other products. Sculpture can actually help a little bit more on the upper pole. You tend to cluster it, and it does actually lift a little bit. And Sculpture is a PLLA, a polyl-lactic acid. That's a product that, again, has been around for a long time, recently gained a lot of headway, especially with their new FDA indications for treating in the face. But we do utilize that in body components too. The third one, and really kind of our personal favorites, is Renuva. And Renuva is something that is just totally different. It is not a filler. It is not bound by the same restraints. It is not bound by any of the regulations that comes with, because it's not a filler. This is a product that it's actually an allograft tissue, which means this is a product where it's not fat, but if you think of off-the-shelf fat grafting, that's what this is. So you're bypassing the process of having to go under surgery to have liposuction, to then centrifuge, and then to re-inject. What we get to inject, it's kind of in reverse, and that's why we treat in stages. If you think of fat grafting, usually you're injecting to know, like, hey, I'm actually going to have a diminishing effect or a diminishing return on this.
About 60%.
Exactly. And with Radius, it's actually the total, not quite opposite, but you're expecting this to increase in size because what we're injecting is the stromal matrix. So if you think of like that honeycomb.
Renuva. Yeah.
So if you think about Renuva, you're going to have a product that is actually, it's not fat, but it's the product that holds fat. And that's what that
scaffold.
Exactly. Kind of like that honeycomb. Yes. Everyone talks about that. And that honeycomb, it really, imagine like the fat lobules in there. And then they come in and they take that fat lobule out, but they leave that honeycomb. And that honeycomb is what we inject. And then that recruits your own fat cell. The Renuva itself actually drops off in about 6 months. But upwards towards about 2 to 3 months is when you really start seeing your maximum results. Furthermore, you're getting the same stimulation of growth factors, collagen, elastin, the whole 9 yards. And your duration on something like that far exceeds any of the products out there because you're going to get the same duration as fat, which most studies find is upwards towards 10 years. So your duration on something like that is pretty phenomenal. The application that it has to the glutes is just that, you're kind of bypassing the process of having to go through the process of taking your own fat, centrifuging and injecting. It's kind of my go-to product for a lot of people who've already had a BBL and is looking for that, hey, what's next? I didn't get the results I want, because you're looking for duration. And if you're going to make an investment, you want to see that.
I have a girl from Canada that's come maybe 4 or 5 times specifically for Renuva. To like full body liposuction, divots, depressions, scars. and it works amazing.
Wonders.
But with the added benefit that you can build on it, it's not an inexpensive product.
Yeah.
Averages 1,000 per 1.5 cc's.
Mm-hmm.
But for the longevity of that and the safety profile, I think it's really the future of a lot of anti-aging.
It is. And we can modify the product in a way that, this is a product where it has no bounds, it has no limitations. Really, the two main areas you would never inject it are the tear trough and lips.
Right.
Anything outside of that, anywhere your natural fat would live or does live, it's a great product to use.
Have you seen any complications from Renuva?
I have
experience?
not. I did speak to one of their higher ups, and there was such a small incidences of someone having just mild erythema and a mild reaction, of which they gave them Benadryl and it subsided.
I have not in 7 years.
No.
Fat grafting is more prone to fat necrosis. You can get cysts,
and that hardening is
Yep.
But no, Renuva, I have not seen any complications with that. And in terms of physical limitations, it all depends on the amount that we're using. The most fully transparent, I'm always open to say, the most I've ever injected for someone's glutes was 30 cc's. And that was
one treatment?
In one treatment.
That's amazing.
She flew out from California.
That's amazing.
I did a telemedicine consult. She had found me, and so she came out, and she had recently had a BBL. BBL was about a year ago, and just was not happy with the results that she had. She still had more of that hip dip that we talked about. So we ended up blending this down. She flew out. We set her up in a hotel, and she did great. She really did wonderful, and she was really happy with the results.
Amazing.
Yeah.
And we see a benefit in the skin because of the growth factors, and we know when we inject fat, we see regeneration, anti-aging properties from that. We do a lot of fat grafting to the face at the time of surgery and breast, and Renuva does have that added benefit as well.
I mean, you look at most plastic surgeons, you find in a facelift, fat grafting versus not fat grafting, you're always going to default to
fat graft. Yeah, absolutely. So we're big fans of Renuva, if you can tell.
I don't know what gave that away.
As far as skin texture, skin we know loses elasticity as we age. One product we like to pair, I say if you do nothing else, even if you don't do injectables or procedures, if you're concerned about skin quality of any body part, we do strongly believe in the Elastin line of products, which have the Trihex technology, which anti-age the skin by triggering your skin to produce more elastin fibers. So that's great. They have a body product called Transform.
That's good.
Which is really nice.
Yeah.
So I think regardless, that is a wonderful product for the gluteal area and legs if you're concerned about skin quality. Do you want to comment on glycolics for texture?
I think they help. I think it's going to be a huge benefit. There's a lot of different options too. It depends on what's commensurate with the time you have. Ultimately, I always look at 3 things in a consult in terms of what the patient wants: your goals, your timeline, and your comfort.
Absolutely.
And your comfort's bimodal. It's your physical comfort and your financial comfort. So too, when everyone's listening, I don't want you to think that we're throwing like everything at you on this. We just want you to know all of the
comprehensive options
that exist. Because ultimately, we're looking at this from a 3-dimensional view. What's underneath the skin, what's in the skin, and then what's on top of the skin. And from a textural standpoint, even from a textural standpoint, there used to be a product for the glutes that a lot of people did, and it was called Quo. Unfortunately, that is a product that did not follow through in the way that they're and this is it was an FDA approved product. It since has been repealed and no longer on the market, but that product was used intentionally to treat cellulite specifically for the glutes. A lot of times people used it for other areas as well, but for that on the glutes, it did do a good job. What they failed to mention, especially in their studies, was the potential for that hyperpigmentation to form. So I think from a retexture or repigment, or like if you have sometimes people do have scarring. If that's ever the case, like that's a little bit more difficult to treat. But I think from a texture standpoint, glycolics will play a big role in that.
Agree. And new to the game is a device called Ellacor. I have
Mhm.
not treated gluteal areas with Ellacor yet. I'm open to it. I just haven't had a
Yeah.
patient that wants it. It's FDA approved for lower face, skin reduction, microcoring technology. I've done arms, abdomen. I think
I love
the
that machine.
gluteal area is the next frontier, right? Because it can physically remove skin. You're getting the added benefit of the coring that will stimulate collagen.
Mhm.
It's kind of like microneedling on
Yeah.
steroids with the added benefit of the physical removal of skin. So
It's
open to
so-
that.
It's so neat, like the transition of medicine and how things keep coming out. And
Yeah.
it's, surgery will always play a role. It
Yeah.
will. But it's so neat to see when things
Yes.
are coming out and saying, hey, we want to get results that are commensurate with almost a surgery-like process
Right.
without having that.
Yes.
That's so, I think that's
yeah,
amazing.
you
for
can't
patients.
compete with the safety
No.
profile. Ellacor removes skin.
Yeah.
If you really wanted to also tighten skin in a non-invasive way, there's RF microneedling that we have the Virtue
Mhm.
device. And then we talked about the dual benefit of Renuva and Radius effect, the benefit of the skin.
Mm-hmm.
So it's kind of like we said, the 3 dimensions. So then I think a challenge, this could be a podcast in itself, cellulite, but cellulite is a challenge. I love talking to Max about it because he reminded me, like, cellulite serves a purpose. So I want you to definitely touch on that.
Yeah.
And then we'll talk about what we can do about cellulite specifically.
So I'll go back onto the comment I made with Quo.
Mm-hmm.
What Quo is it was actually originally this enzyme that breaks down collagen, and the initial indication of it was for Dupuytren's contracture.
Collagenase.
Yep. So it would break down collagen, and it sounds like it's like the antithesis of what we would want to use, especially in aesthetics, because you hear everything, we're trying to stimulate collagen, so on and so forth. But what cellulite really is it's your internal power line, is how I really explain it. When you think of a power line, it's attached to the deep fascial plane.
Mm-hmm.
And when you have that fascia, it tethers all the way up to the skin. Now, over time, we start increasing the size of fat lobules, and sometimes that tethering band, it's really strong, and it holds right there in those
it's like
little
a pucker.
It does. And so those fat lobules kind of get around, and it dimples in because of that. That's why when you flex and you really tighten the muscle, that fascia kicks in a little bit, and that tightens it up, and it usually accentuates those dimples. And that's why whenever I'm doing any treatments of cellulite, obviously I'm always going to have you standing. I mark everything, and then I have you lay down. But ultimately, we never want to get rid of all cellulite.
Right.
We want to get rid of your named ones.
Right.
The Susie,
the key
Jenna.
players.
Exactly. Those ones that you really name, that you look in the mirror and you're like, I just don't want to see that.
Yeah, you brought up a good point about when Quo was used off-label or overused in the thighs and the legs, and
you're taking the potential risk.
Yeah,
you're going to take the risk of saying it might look good for the next 5 years, but in 5 years it's going to age 10 years.
Right.
Because you don't have the structural support, and with time, that little bit of laxity on the top part of the knee, people tend to focus in on that, and you can't really undo that aside from the removal of. At that point, you're tightening, and Ellacor would be a reasonable one.
Yeah, I've seen some really compelling knee photos.
Yeah.
There's not a great surgical correction for knee skin. So it's exciting.
Yeah.
How are you treating cellulite in the office?
So a lot of times it ends up being a little bit more subcision. It really is. So if you think about the breaking up of a band, sometimes we'll take a needle, sometimes we'll take a cannula. It depends on how strong the band is.
So subcision is the physical lancing or cutting under the skin of that band, very targeted, very precise.
You have to know your depth, and you have to know what you're doing on those, because if you don't, a lot of times we'll add a little anesthesia, just like lidocaine, to make it more comfortable for you. Always a potential risk of bruising with those, but our goal is to really try to soften up some of the bands, not all of them, but just the ones that are, like I said, the named ones.
Do you believe in filling immediately post-subcision?
So I do, especially if I'm there,
so.
and you're already having that little bit of reaction. I'm forming a pocket.
Right.
I want to maintain that
buffer.
Exactly.
Yeah.
And to your point, like, that's why we treat these things in in a systematic approach, and we're not saying, hey, we're throwing everything at you. We treat low and slow. Right. And we'll see you back in 2 months and kind of reassess.
It's a journey.
It is. The last thing you ever want to do is say, hey, it's a one-stop shop. Everything's good. Right. Because nothing's that great.
And I think layers are important. You're kind of building trust. You're building a relationship as you go. And it's
the best thing we can do. One of the things I love, when I first came on and I first saw you do one of your Ellacor procedures is there's no one to answer to other than the patient. Right. And ultimately, when you do Ellacor for someone, you're not saying, hey, you need 3 treatments. Mm-mm. It's, hey, let's do 1 treatment. Let's have you back. Let's see how you do. Yeah. If you think, hey, there's more left to be desired, I would like to see what my options are in terms of getting more of an improvement. I've seen what works. I love it. Would it be better? Right. And then that's where we're here to say and to be an advocate for our patients and say, absolutely. Yeah, I think that this is reasonable.
I always say that we want results as much or more than the patient.
We do.
And the experience has to be a good experience procedurally. Yeah. It has to be a tolerable recovery, and it has to be a tolerable expense, right? You should not go into debt for these
absolutely not
topics. It should feel comfortable across, just like your consult. It should feel comfortable in all 3 aspects. So I think in summary, for revision BBL, call us. Yeah. There's hope.
There is.
There's hope. There's solutions.
There's a lot of options.
Anything else that you want to cover?
I think that we really hit just about everything. I know we threw a lot out there. Just know that, our consultations are just as us talking. Mm-hmm. This is, I think we give more information than we spend more time talking than we do even treating. Mm-hmm. And agree. Our goal in that is to educate you. We're not here to say you need to do anything. We're here to give you your options. Yep. That's the benefit of coming here. It's always an open forum and an open discussion. Perfect. And if nothing else, the conversation you hear us having right now is the same conversation and the same. It's comfortable. That's
absolutely.
All I can say.
You can see Max in Indy Atlantic on our 5th Avenue office and our Vieira office. Yeah. And you can see me. I'm at the Vieira office. Mm-hmm. We would love to meet you, talk with you. I hope you enjoyed this episode on synergistic and safe solutions for gluteal shaping. Let us know what else you'd like to learn about. Thanks for having us. You can always check us out on www.foryourbestself.com or follow us on Instagram at @drsaluja_Dr. Novo. We'll see you next time.
Take care.